Well, health promotion is a major arm of public health. I think of it as one of the major delivery arms for prevention strategies. And it's engaged with many of the public health priorities that we're tackling in Australia. So to put it into a nutshell, health promotion is concerned with the use of educational, communication, environmental and policy strategies to prevent disease and injury and to promote health. So it's characterised by the use of a range of different strategies, usually in a way that's complementary to each other, and a focus on trying to not just take away risk factors, but to empower individuals and communities to be able to maintain and improve their own health into the future. Well, health promotion, as we think about it today, has changed in some significant ways over the last 40 or 50 years. About 30 years ago, we saw a very marked transition away from a pure focus on health education to more of a recognition about the importance of the social and physical environment in which people live and work and recreate. So health promotion has taken on a much greater recognition of the different levels of influence upon people's health and a focus on the kinds of strategies that can be introduced to address those different influences on health. Now, we've adopted a language which refers to the social determinants of health that builds on the social model of health, which recognises the range of different environmental and policy factors that affect health and well-being in the population. One thing that I think has characterised health promotion has been a continued learning around how we apply that understanding, how we use it in the way that we design and implement our strategies. And we're becoming better at evaluating what we're doing and learning about ways of addressing the social determinants of health to try and tackle inequities in health that we see in the population. I think another thing that we've seen very recently, as you would imagine, with the information communication technology revolution that's been taking place, is that the field has looked at ways to creatively adopt web-based health promotion, as I referred to earlier, smartphone-based health promotion and other ways of using technology to try and engage people at different points in their lives. Health promotion practitioner is a person who is employed in a role to manage and implement a health promotion strategy. There are a number of positions that are held by people in regional health services, community health services, funded by the Department of Health and Human Services in Victoria or other health agencies in other states. And of course there are a broad range of non-government organisations that are involved in health promotion. We think of the Heart Foundation, Cancer Council, Diabetes Australia, Beyond Blue, AIDS councils and many, many other non-government organisations which employ health promotion practitioners to design, manage and implement strategies to tackle different priority health issues. Well, in regard to the success of health promotion in Australia, I think we can rightly be viewed as an international leader. We've had some remarkable achievements through our implementation of multifaceted health promotion strategies in this country over the last 30 years. Some of the standouts are the dramatic reductions that we've seen in tobacco use from something like prevalence of 40 to 50% 30 or 40 years ago to now being under 20%. And that's been a result of, as I've referred to already, multifaceted strategies that have included education, communication, organisational change and policy development. We've seen dramatic reductions also in the numbers of motor vehicle accidents and traffic-related fatalities in this country, again as the result of our coordinated health promotion efforts. Another standout is the dramatic success that Australia achieved alongside one or two other nations in the early stages of the outbreak of HIV in the 1980s. We were seeing quite alarming rises in the incidence of HIV, particularly in some high-risk groups, and yet through successful implementation of health promotion strategies, we saw that turned around quite rapidly. So there are a number of different examples, and I could mention a range of others, where health promotion strategies, when implemented using what we understand as being best practice methods, have made very tangible difference to the health status of the Australian population.